Good afternoon, everybody. Thank you so much for joining us. I'm Jim Skogsbergh, President and CEO of Advocate Aurora Health. We really appreciate you joining us for this 6th virtual town hall meeting, and we are grateful to have two of our outstanding clinical leaders with us here today to discuss all the latest information about COVID-19 vaccine. That includes the science behind the vaccine, where we're at in terms of the approval and distribution process, what to expect in the coming days, weeks, and months when it comes to you and maybe when it's going to come to you and your loved ones. We'll also talk about why wearing masks, maintaining social distancing, and washing your hands will continue to be critical until enough people get vaccinated. So with us today, Dr. Rob Citronberg, Executive Medical Director of Infectious Disease and Prevention, and Jane Dus, Regional Chief Nursing Officer and co-leader of Advocate Aurora's COVID vaccine distribution program. Thank you both for joining us here today and discussing really what's on everybody's mind, vaccine, vaccine, vaccine. It finally seems that we're beginning to get to the end of this pandemic, which is good news. We want to ensure our patients, their families, our communities, that your questions will be answered as this vaccine starts to become available, and we'll get to that. I think we have maybe 200 questions that have already been coming in, so we're gonna take these as they come. And we do recognize, and I know you'll both give this caveat, that things seem to be changing by the minute. We know that, but I have no doubt that these two individuals are going to be a great resource for all of you here today. And by the way, you can also find all the latest COVID-19 vaccine information at aah.org/vaccine. That page will continue to be updated. Again, aah.org/vaccine. Before we dive in, just a few quick housekeeping notes. First, submit your questions, please, and your comments. We'll try to answer as many of them as we can in the time that we have available. Second, should we run into technical difficulties, and we hope we don't, we'll make sure that this video is available on our Advocate Aurora Health Facebook page for later viewing. And we'll also have closed captioning when we push this out. Finally, please take the survey after the town hall to give us your feedback. It's important to us. We plan to do more of these in the future, and your feedback is invaluable. All right, let's get to it. Rob, Jane, thank you so much for being with us here today. Let's begin, maybe Dr. Citronberg. And by the way, when I ask these questions that folks have, this is really in service to our patients and the communities. So when I ask a question, feel free to jump in, both of you. You guys have been great partners for months and months and months, so today should be no exception. But I do want to start with sort of the most often asked question, and that is it safe? Dr. Citronberg, tell our viewing audience about the safety of this vaccine.
Thanks, Jim. First, I'd like to say that the vaccine is incredibly effective. It proved 95% effective in preventing COVID-19 in members of the participants of the trial, which is really, it knocked it out of the park. For example, the flu vaccine is about 40 to 60% effective. 95% is probably the best efficacy we've ever seen in a vaccine trial. Now, is it entirely safe? Are there no side effects? No, of course there are side effects. We expect there to be side effects because the side effects, for the most part, tell us that your immune system is responding to the vaccine and generating antibodies, which is exactly what they want. The companies that performed the trial, Pfizer particularly, did not report any serious safety concerns. I think whenever you look at side effects, you have to look at the alternative. The vaccine is to a large part unknown because we don't have long-term data on it, but what is known is COVID. And we know that COVID makes people sick, very sick, and die from it. We have really good data on what COVID is. And after looking over all the data that's available, I think that the risks of getting COVID, getting sick from COVID, and dying from COVID far outweigh the risks of the vaccine. Now, we will continue to study adverse effects of the vaccine going forward, probably for up to a couple of years, but at this time, it looks like a really favorable safety profile.
Yeah, thank you. That seems to always be the questions that get asked. Here's another one, and I know you'll quickly break this down. The question has to do with the need for 2 doses. Now, that's Pfizer. So why don't you talk a little bit about the 2-dose Pfizer and what we expect in the weeks ahead?
Sure. The Pfizer vaccine is given in 2 doses, 3 weeks apart. That's how it was studied. They did show that there was some protection after the first dose, but it's really important to get the second dose of the vaccine to provide complete protection. Now, next week we may have another vaccine available from Moderna. That's 2 shots given 4 weeks apart. Again, you need to get both shots to complete the series. And it's also important to complete the series with the same vaccine that you started with.
So explain to the audience why 2 shots instead of 1. Talk a little bit about the notion that that you have to come in twice rather than simply just once.
Many vaccines require multiple doses. The first dose essentially primes the immune system to make the antibodies, and the second dose enhances that response.
Thank you. Jane, so as the lead of our vaccine committee and distribution effort, maybe the second most often question is, who's getting it first, who's getting it second, who's getting it third? You want to talk a little bit about that process?
Sure, Jim. I think the key point here is everybody who wants the vaccine will get the vaccine. And we use the word eventually at the end.
Right.
We believe that people will get the vaccine within 4 to 6 months. And the good news is you've probably seen on the news trucks driving up to healthcare organizations delivering vaccine. And that's because the CDC's Advisory Committee on Immunization Practices has designated healthcare workers and residents and staff of extended care facilities as priority 1. And within that prioritization, there's high risk, medium risk, and low risk. And so we are following the state, the federal, CDC, and our own medical ethics guidelines to make sure that we're distributing it to that high priority group. And for us at Advocate Aurora and across the country, it's those frontline team members.
Right.
So those are the ones that are getting the priority for the healthcare, for the vaccine right now.
So let's just make sure we understand the viewing audience. Most of the viewing audience would be patients, right?
Correct.
So time frame. Now I know that's unfair because we don't know exactly, but since I got you and you put you on the spot, when do we think this might be available to the public?
Sure.
We've got our healthcare workers taken care of, we've got essential workers taken care of, and now it's folks in the public.
You know, the top 3 priorities is after healthcare workers, extended care is the essential workers, and then high-risk patients with high-risk medical conditions over 65. So a lot of our patients will really be in that first priority group once we get to that 1C level. But we believe that there'll be enough vaccine for the general public to be vaccinated maybe by late spring, early summer, and some reports may be even earlier, depending on when the vaccine is available. And as supplies increase, we'll be able to do that. I do want to comment, though, that children at this time are not eligible to receive the vaccine under the age of 16 until more studies are available.
Thank you, and that will answer several questions that have already been provided to us. Rob, I know you're keeping up to speed on all the latest. Any additional information about time frame?
We think the Moderna vaccine may be available as soon as next week if the FDA grants emergency use authorization, which will really add to the supply of vaccine. And there are a couple of more vaccines in late-stage development. There's one by Johnson & Johnson and one by AstraZeneca, and we may have those vaccines by late winter or the spring. So there should be a pretty good supply of vaccine available in the U.S. come springtime.
Yeah, Jane, just to repeat what you said, because I love the way you said it, which is anyone who wants the vaccine will be able to get it eventually, right? So that's the...
And our goal is that the vaccine should be easily available in pharmacies, doctors' offices, hospitals, federally qualified healthcare centers. But right now, we really need to focus on where the priority is, and that's healthcare workers.
Yeah.
And as supply increases, our goal is to get it out there for everybody who wants it.
Excellent. Okay, so let's talk a little bit about those that are concerned about getting the vaccine, and they don't fall into one bucket, they fall into about 100 different buckets. Let me cover a couple that have already reached out to us. Pregnant women or breastfeeding women. Good to get the vaccine? No, don't get the vaccine. Which is it?
It's right in the middle, Jim. So pregnant women were excluded from the vaccine trials, so we have no data on the effectiveness or safety profile in pregnant women. Now that being said, there are many women, particularly our own team members, who work in high-risk areas, maybe work on a COVID unit, maybe work in the ICU where there is significant risk of exposure to COVID-19. So what we did at Advocate Aurora, we convened a panel of our top experts in our system, Dr. Windsor, Dr. Iannucci, Dr. Belmonte from obstetrics and gynecology and pediatrics, and we have a plan now for our team members who are pregnant or considering being pregnant, that if you have a discussion with your clinician about the potential risks and benefits, you will not be prohibited from receiving the vaccine. But we want there to be a really good conversation with your doctor to determine if the vaccine is right for you. So if in the end you decide that that vaccine is right for you, we'll provide it for you.
Thank you, thank you. Next group that gets raised, how about people with allergies? Now, I know that's a broad question because the allergies vary significantly, but just generally, people with allergies.
For the vast majority of people with allergies, receiving the vaccine should not be a problem at all. There were a couple of reports from the UK after they rolled out the vaccine last week. 2 healthcare workers had severe allergic reactions to the vaccine. Now, what's important to note is both of them had severe underlying allergies. In fact, they carried EpiPens with them because of their allergies. The current guidance is if you have general allergies to bee stings, to peanuts, even to some medications, there should be no reason why you can't receive the vaccine. The really only reason you can't receive it is if you're known to have an allergic reaction to any components of the vaccine. Even if you've had an allergic reaction to other vaccines, you can still receive this one. We will ask you to wait for 30 minutes, to be observed for 30 minutes after your vaccine period. And it's really important to note that every Advocate Aurora vaccination site has nurses and full equipment to take care of you should you develop an allergic reaction.
Thank you. And then we had someone write in and ask specifically about Bell's palsy. Is that a category that they should or should not, or do we just not know yet?
So the concern is that there were 4 patients in the Pfizer trial out of about 40,000 plus in the trial that developed Bell's palsy during the vaccine trial. All 4 of those turned out to be in the vaccine group, not in the placebo group, but the biostatistical analysis suggested that that was approximately the baseline rate, the expected number of cases in the population. So it would be irresponsible to say at this time that the vaccine causes Bell's palsy. This is something that we'll continue to study, but in my opinion, it's not a big concern, and the concern over Bell's palsy should not really prevent someone from getting the vaccine.
Yeah, thank you, thank you. Jane, back to you for a moment. People are curious about cost, right? Cost of health care, big issue in this nation, and they're asking, will it cost me to get the vaccine? And I know that answer is not entirely clear yet, but why don't you do the best you can today?
Sure. So what I can say at this time, we do know that any vaccine that has been purchased or paid for by U.S. tax dollars will be available free to the American people. We know that. We don't know what's going to look in the future or costs of potential administration fees, but really right now we know the cost of the vaccine will be free if it's been paid for by the U.S. tax dollars. That may be subject to change in the future, so that's what we know right now.
Yeah, thank you, thank you. Dr. Citronberg, if someone has already had COVID, or so they tested positive for COVID-19, should they still get the vaccine? This is that question about I'm now bulletproof because I tested positive. We, of course, know that's probably not the case.
So the answer, Jim, is yes, you should get the vaccine. The only question is the timing. We are recommending that if you've had COVID, that you wait at least 3 months until after your COVID infection has resolved before you get the vaccine. It's really important to understand that people who had either an asymptomatic illness or a mild illness may not generate enough antibodies to provide immunity against future infections. So we absolutely want people to get immunized. If you've had COVID before, we just want you to wait about 3 months. And if you were someone who had COVID and received either convalescent plasma or a monoclonal antibody, we absolutely want you to wait at least 3 months before getting your vaccine, but you definitely should get it.
Got it, thanks. So in that spirit, Jane, of now it's time for me to get it, the question is, how do I make an appointment to get the vaccine? If I'm high risk, will I be contacted by my physician's office? Should I be contacting my physician's office? How does that work?
So Jim, those guidelines are not clear yet because we're waiting for the Advisory Committee on Immunization Practices, which is actually meeting this weekend to give advice on essential workers and high-risk workers on how that prioritization is going to work. So once we have their guideline and once we have enough vaccine, we need to get through, it's the roughly 24 million healthcare workers and extended care facility residents that need to get it first, then the roughly 80 so million essential workers, and then we'll get to that third level, the top priority. So more to come on that,
Yeah.
And we're waiting for clear guidance from the CDC on how that will happen.
Thank you. Yeah, when you think about it, what a massive effort, right? This mobilization of the entire nation, actually the entire world, for this vaccine. More on that here in a couple of minutes. Dr. Citronberg, you've perhaps already answered this, but I'll raise it up because it's written in a different fashion. Are there long-term effects of the vaccine?
We don't know, obviously, because the vaccine's only been studied for a few months. At the 2-month mark, which is when the request for emergency use authorization was submitted, there were no serious safety concerns. Now, the Pfizer study was designed to follow the participants for up to 2 years, and that's exactly what we'll be doing. We'll continue to scrutinize the participants in the trial and also people who get the vaccine after the trial to determine if there's any long-term effects. But I must phrase this in context. We absolutely know what the long-term effects of COVID are. And even if there are some long-term effects of the vaccine that occur in a few people, there is no way that that's going to be anywhere nearly as important or significant as the long-term effects of COVID in our population.
Yeah, thank you, thank you. Kind of follow up on that same theme. How long can I expect the vaccine to protect me once I've received it?
It's also in the category of we don't know yet because we haven't had enough time to study. There's a few scenarios. One is that your initial vaccine series will last a lifetime. Another is that you might need a booster after a few years. And the third is that you might need annual immunization. And we'll know that even probably as soon as next year and give advice. But right now, our primary motivation, all our energy is going to get that primary series in so we can end the pandemic.
And you and I had a conversation off camera about this. The good news, I think, if I interpreted your answer correctly, is that that'll be crystal clear. It's not going to be one of those things we guess at. We'll know if you need to get it annually. We'll know if it's a lifetime protection. We'll know if you need to get it, more frequently. So that's good news. So that there's going to be a bright line on that particular question.
Yes,
there?
for sure.
Yeah. Thanks. Next question. So this has to do with strains, and I think probably people are thinking about flu, right? So how many strains will be covered by the vaccine? How would you answer that?
So this is a little bit different from the flu vaccine. Now, when you get your flu shot, depending on what kind of shot you get, there are either 3 or 4 different strains of flu that are in there that you generate antibodies to. The current vaccines, the mRNA vaccines, they make your body produce antibodies against the spike protein of the coronavirus. And even though there's probably some mutations in the coronavirus, at this time it looks like that antibody against the spike protein will protect you against every strain, every mutation of coronavirus. Now that may change in the future, but right now we feel comfortable that for everybody or almost everybody, the vaccine should be effective.
So Jane, a question, and I know we don't have all the answers yet, but I just love the fact that the folks out there are curious about these things and are willing to ask us. Will there be drive-through vaccination sites?
Not at this time. We're not planning on it. It's a new vaccine. We haven't given it to many people, and I think it's very important that we do that observation period, and we'll have to do it in line with our safe care promise, the 6 feet apart, but it's really important, at least initially, until we have good science that people aren't having challenges, but we're not planning any drive-through flu clinics at this time.
Yeah. So say another word about the observation time, because folks might be curious, do I stand in line and receive the shot and then I leave? And that's not quite the case. As we are vaccinating our own team members, we're actually keeping them for a period of time. What is that approximate time?
It's based on the recommendation of the CDC and ACIP, I believe, that is saying it's at least a 15-minute. So this is not your typical flu shot. This is a brand new vaccine that people haven't received before. So after getting the vaccine, we are going to have them sit and be observed for 15 minutes. And then if you've had a history of allergic reaction, we will be keeping you for the full 30 minutes. So it's a little bit different than getting your flu shot and leaving. But it's really important because it's such a new vaccine. We want to be extra cautious.
Yep, and it gives people, the viewing public, an opportunity to realize, okay, I'm not going to slip in and slip out. There's a time commitment involved with receiving this vaccine. Rob, if you don't mind, I think you've answered many of these questions, but I want to honor the people that have written in. What is it safe for chemo patients that are receiving chemotherapy? And then the follow-up is, what about cardiac patients? So again, we're breaking patients down into various categories. Start with chemotherapy.
People with underlying health conditions are the prime target for this vaccine because we know that people with underlying health conditions, including immunosuppression, are more likely to get seriously ill or die from the virus. So we want to target that population especially. There is no contraindication if you have cancer and are on chemotherapy. The only caveat is that the vaccine may not work as well, at least theoretically may not work as well in people who are immunosuppressed. We don't know that to be the case, but there are no safety issues. It's going to be safe for those people to receive the vaccine, and very important. So if you have cancer and you're on chemotherapy, if you're elderly, if you're over 70 or particularly over 80, you've got chronic lung disease, chronic heart disease, you are the prime candidate for the vaccine.
Thank you. Now here's another question. So I received my vaccination. Am I still at risk of passing on COVID? And is there a time period where I'm still sort of in danger a bit?
So the answer is we don't know, but there is at least a theoretical risk of transmitting the virus, which is why we're asking our team members and the public not to relax any restrictions regarding masking or social distancing. What the Pfizer trial showed is that people who got the vaccine did not get sick from COVID. It didn't address whether or not they actually acquired the virus and just didn't get sick from it. So let's say you got the vaccine, you could acquire that virus, it could live in your nose, you may not get sick from it because you got the vaccine, but you could pass it along to others. So until we have more information, we're going to ask everyone to continue masking, continue social distancing, and that will probably continue until we've achieved herd immunity in our population.
Which again, 70% or so, Dr. Citronberg?
We think at least 70% of the population to be immunized will achieve herd immunity for this virus. And after that time, things should start to look a lot more like normal.
Yeah, look like normal again. Wow, won't that be something? Jane, a question for you, and I appreciate this one. What's the process of prioritization to ensure that no one who is high priority falls between the cracks? So they might want to know a little bit about how are we handling it? Email to everyone, inviting them, they can sign in for a particular scheduled time, et cetera?
Sure, so there are actually two processes right now for the Advocate Aurora team. We've worked with each of our sites and our leaders to identify who are those team members that are working in the highest risk area, the highest exposure. And that list is constantly changing. And so as we know, we have our confirmed vaccination schedules. We're sending out email invitations. Our goal is to have every slot filled, so we're going to continue to work down the list of, the high priority, the medium priority, and the low priority, but we want to make sure that we get that invitation out. For the general public, we're still waiting on the ACIP guidelines on how to determine that prioritization.
Yeah, so let's just stay with our team members since that's
Sure.
currently in place all across the country, right? So we have a team member, and this is a personal choice, so we have a team member who is high priority, and he or she says, I'm going to pass, I'm not quite ready. And then their colleagues receive it and they read a little bit more and get educated and say, I'm ready now. What's the process of slotting them in?
Sure, actually that would be ideal. And we really want people to get excited and really encourage others to take it. So those team members that have received the email invitation with the unique code, that code and invitation doesn't lapse. So our goal is as we continue to get more and more vaccine, we'll be opening up more and more clinics, more and more slots. So if you've received the vaccine, that's been indicated that you are a priority and you can schedule when you feel it's right for you.
Got it. And that invitation does not go away. It's always there. So slide in and grab a slot, right? Yeah, very good. Thank you. Okay, so this might be interesting for you, Rob, because I know you get questions all the time. And the basis of this question goes like this. We know there's a lot of misinformation out there, from microchips in the vaccine to ingredients that alter your DNA. It's kind of hard to break down fact from fiction and so on. Especially when false news is also being presented as sort of breaking news all the time. Do you mind clearing up some of the myths that you've heard and just say, hey, these are 2 or 3 or 5 things that I've heard that are just not true? Kind of an open-ended question.
Well, I think the first one that you mentioned, that there is a microchip in the vaccine and that Bill Gates will be tracking you with 5G, it just isn't true. But there are rumors, and there's a big misinformation campaign being circulated mostly on social media by anti-vaxxers that just isn't true. For example, that the vaccine causes sterility. This has come up a lot. A lot of our team members have asked about this. There's absolutely no evidence that the vaccine causes sterility. Another myth is that because this is mRNA technology, that the mRNA is going to get into your genes, it's going to transfer into DNA and alter your genome. That's absolutely impossible. That won't happen. So I think the bigger context, Jim, is people are going to have the right to choose to receive the vaccine or not. For those people who decline the vaccine, we just want to make sure they're using the right information to help make that decision, using information from reputable sources from science, not from somebody on Twitter who has an idea. So make sure everyone's getting the right information about it.
Yeah, so stay with me. This next question has to do with those that have not received. So if I get the vaccine, is it safe for me to be with people who have chosen not to receive the vaccine? And you're probably going to go back to mask and hand washing and distancing, but please do.
It's safe for you because you've received the vaccine, but we'll still ask you to wear a mask and maintain social distance to protect others. But obviously, as more of the population gets immunized, it's going to be less of an issue.
Yeah, so again, you mentioned earlier, Jane, I think it was you that said, children under 16 are not included right now. But this question, it's a good one. What about children whose parents are at a high risk of, in this case, it was a high risk of dying from the virus? Are there exceptions being made for families that are, particularly at high risk?
I may defer to Rob on this. It might be a clinical question, but it was not studied in children, so.
Right.
Dr. Citronberg.
Yeah, the better strategy there is to immunize the parents if they're at high risk for getting complications. The vaccine is licensed under emergency use authorization, so the criteria for administering it are very strict. Right now, it's only 16 and older. The companies are studying kids 12 and older right now. Maybe come next year, we'll have some more information about those kids. But outside of that, best strategy, immunize the parents.
Yeah, there you go. Thank you. All right, so I'm allergic to the flu shot, meaning I probably had a reaction to the flu shot. Am I certain I'll be allergic or have a reaction to the vaccine?
Well, the only real contraindication of the vaccine is if you had an allergic reaction to one of the components of the vaccine. And those components, by the way, are very few. There are no preservatives in the vaccine. There is no mercury in the vaccine. So if you've had a severe allergic reaction to another vaccine, you can still receive this vaccine. We'll ask you to wait 30 minutes of observation after you receive the vaccine. And in the very unlikely event you do have an allergic reaction, we'll have the staff and the equipment at each site to be able to treat you.
So all these questions are very, very similar, but there's unique pieces to them. So let me just ask, should someone still get the vaccine if they have had side effects after having COVID-19? I think the answer obviously is yes, correct?
Doesn't change at all. In fact, if you've had a bad course of COVID-19 and you get infected again, you could easily have the same course. So for sure, we want you to get it. We just ask that you wait 3 months until your infection is resolved and then get the vaccine.
So next question, what are the signs or symptoms of a reaction to the vaccine? What should people be, sort of thinking about or looking for?
Well, the most important thing is that the majority of people who get the vaccine will have a reaction to it, but we like that. We call it reactogenicity. That's your body reacting appropriately to the vaccine. So you will very likely have a sore arm, maybe some muscle aches, maybe some low-grade fever, chills, maybe a little bit of fatigue. Those are good side effects. That tells us that your body's responding. Now, in the trials, those side effects were more prominent after the second dose of the vaccine and also in younger people. So something to keep an eye on. But in terms of immediate reactions, those would be allergic reactions. Those would be things like swelling, hives, perhaps difficulty breathing. Those will be addressed immediately at the site where you get your vaccination.
So another question that comes up frequently is, all right, so I know Pfizer is available today, Moderna very shortly. You mentioned several others. Should I wait? Is there one that's more effective than the other? Are they all good? How would you answer that question?
Right now, the two that one's available and one's probably going to be available very soon, both show superb efficacy, 95% protection. I think we'll have to wait and see what the data is from the other vaccine manufacturers. But I'll tell you that any vaccine that shows more than 50% efficacy will probably be approved by FDA. So my advice is if you have an opportunity to get a vaccine, get it, regardless of who the manufacturer is.
All right, thank you. Here's a great question, and one that I think all healthcare providers are thinking through, and that is, how are you advising, Rob, in your practice, patients, people of color, that might have an aversion to taking the vaccine, and Jane, maybe think a little bit about our own team members. Conversations with that audience or that population that we're kind of anxious about because they're so adversely affected by this terrible COVID-19?
In many communities of color, there is considerable skepticism about receiving vaccines in general. And what we're doing, and we're going to try to do for our team members and our communities very hard, is to just tell the truth, tell the facts about the vaccine, to try to allay fears about the vaccine. And as you mentioned, those particular communities are disproportionately represented not only with the numbers of people who get the disease, but also the severity of illness. It is so critically important in these communities to make sure that people get vaccinated. And we're going to do everything we can to engage our leaders from our own healthcare team and leaders in the community to make sure that those communities are top priority for the vaccine.
So great question here, and that is, are the vaccines available for homebound patients? Homebound, they can't come in and get it, homebound patients, through any service. And if not, will my high-risk mom be okay if all the people who see her, my dad, myself, are vaccinated? So a little bit, kind of a two-part question, I guess, but do you mind taking it?
I'll ask Jane about the homebound people, because I've not heard
Right.
anything about that.
Well, that would likely be defined by the Advisory Committee on Immunization Practices for that high-risk population, that third group. So we'll have some more clarity on that. But I did want to say that those in extended care facilities will be getting the vaccine in this first round through the partnership, a national pharmacy partnership with different chains to go into these healthcare extended care facilities to get the vaccine. So more to come.
Yeah, so if you're in one of those facilities, you'll be receiving it very soon. But if you're not in one of those facilities, still homebound, in a sense, to be determined, right?
Right. You will likely fall into that third level of high priority after essential workers, those 65 or over or high risk conditions. So once we get guidance on that, we can make our plan.
Yeah,
But
thank
then
you.
the second part to your question is, yes, everybody who comes into contact with that high-risk person should get vaccinated. That will absolutely help reduce the chances of that person getting COVID.
So again, Rob, I know you spoke to this a couple times yet, but why is 16 that magic number? You said we're actually now beginning to study 12, but I think it's because all the patients that received it were older than 16, and that's why that cutoff point?
Yeah, that's correct. So in the trials, only people 16 and older were studied, and so we can't make any conclusions about the safety or effectiveness of the vaccine in anybody younger than 16. Hopefully we'll have more information as we go on about younger kids, but right now that's 16 and older.
And so the next question, again, I think you've addressed it, but I want to say it in the way that it was presented to us. What about interactions with medications you're currently on? Is there a concern? So any contraindications because I'm taking this, that, or the other thing?
At this time, there are no interactions that we know about, so everyone should be safe to get the vaccine.
So next one, I heard penicillin is a component of the Pfizer vaccine. If I have an allergy to penicillin that was diagnosed years ago, should I try to get the Moderna vaccine instead?
There's no penicillin in the Pfizer vaccine.
Well, you add that to your list of myths, right?
Correct.
Yeah.
There's
okay.
no, I'll say there's no penicillin, there's no mercury, there are no fetal cells used in the manufacture of the vaccines.
So Jane, a question maybe to you about high risk, patients, that second group, or actually maybe third group, yeah. So here's the situation. I'm a high risk patient, but my wife is not. Can she be vaccinated at the same time as I do because she lives in my house?
We really do have to follow the guidelines for high priority. And so at this time, until we get the guidelines from the CDC, the high-risk patient with the high-risk patients over age 65 or high-risk conditions will get it first. And if you don't meet that category, you'll unfortunately have to wait. But everyone will get the vaccine eventually. So we don't think it's going to be a very long time in between.
Got it, got it. So questions about the fact that this first particular vaccine requires deep freezing storage. Do you want to talk a little bit about the cold chain? Because the question that was written here has to do with how am I going to get a vaccine that's frozen? And of course, the answer is it's going to be thawed when you get it. But speak a little bit about that, if you would.
Sure. The Pfizer vaccine, by the way, is the only one of the vaccines under development that requires this ultra-cold storage. It's been a bit of a logistical challenge to try to figure out how to ship that vaccine and distribute it and keep it frozen. But you are correct. Before the vaccine is administered, it is thawed and it's given at room temperature.
So a question, we're asking you to look into the future now and use your best your best guess. Do you think in the future the COVID vaccine will be a requirement to enroll in public schools?
It's really hard to know. I will tell you this, that we can start with our own team members. We're not mandating the vaccine, and I don't think any organization is mandating the vaccine right now. But I will tell you that it's very likely in the next few months that you will see companies, businesses, whether they be sports teams or airlines, require proof of immunization in order to purchase a ticket. And that may serve as motivation for people to get immunized so they can start to do the things they want. It's unclear right now when or if the vaccine will ever be mandatory. We feel like a better strategy is to encourage people to get the vaccine based on science rather than force them to get it. And we hope that most people will make the good choice to get the vaccine.
And Jane, how are we advising our team members that are signed up for the COVID vaccine but also want to get a flu vaccine? Is it okay to get both vaccines? Could I get them the same day? Do I have to wait? Is there some time frame between the two?
Well, the good news is they should have had their flu vaccine by now. So, and we'll know in the future if the COVID vaccine needs to be repeated, if we can give them together. So that's all to come. But right now, all our team members should have received the flu vaccine, so it should be a non-issue.
Right. And so you would advise the public, the viewing public, get them both, right?
Yes, and as Jane said, you should have already had your flu shot. We recommend that you don't have any vaccine for 2 weeks prior to getting the COVID vaccine, and that's just based on theoretical concerns, but there's really should be no risk.
So, Rob, you and I have talked about this, and Jane, you've been involved in these conversations as well. We're very impressed with the scientific community that have produced this vaccine in such record time, and there's all kinds of reasons. But do you want to talk a little bit about how you think or why this got approved so quickly? Reservations, concerns? Because I think people that ask that question are going back to safety, right? And did we cut corners, et cetera, et cetera? So talk a little bit about why this particular vaccine was approved so quickly compared to, Moderna and the others that are coming along.
Sure. I'll just say in context, the fact that we have a vaccine available now is a miracle. If you had asked me 6 months ago, would we have a vaccine that's 95% effective before the end of the year, I would say there was no chance for that. As it turns out, mRNA vaccines are easier to manufacture than are the traditional vaccines that have been used to treat other diseases. Additionally, most of the financing was already done. So these vaccines were paid for, whether by the government or other sources. And that's usually a stumbling block to get vaccines out quickly. So they were already paid for. So that was taken care of. And third, Pfizer was able to enroll over 40,000 people in their trial in a period of under 3 months, which is almost unheard of for a vaccine trial. So those are all reasons why this trial could be completed so quickly. And we know that in terms of safety, almost all of the side effects of vaccines occur within the first couple of months after immunization. All the important ones do. So we've now had that time period to study. So after looking over all the data and all the methodology of the studies, I do not believe that any corners were cut regarding safety. Doesn't mean that we're going to stop looking at safety. We're going to continue to look at it going forward. But I'm confident that these vaccines were developed and that no corners were cut on safety.
So this is a very interesting question, and you mentioned 40,000 individuals that Pfizer in particular. So what does someone do if they are currently in a vaccine trial right now? Do they wait and let that period pass? They don't know if they got a placebo, if they got the vaccine. How would you advise someone who's currently in a vaccine trial right now?
It's a great question. We've actually gotten that question from quite a few people who are involved in trials with other manufacturers. And the answer is you need to talk to your study coordinator where you got the vaccine, and they will advise you whether or not you can get another vaccine.
Thank you. Jane, you mentioned essential workers. Here's a question. Are teachers considered to be in the high priority group?
So that it is a big debate on how you define essential workers. I have seen teachers included. It's really those people that have to go to work. But with remote opportunities and virtual, we're waiting on the ACIP guidance on how to define essential workers. I have seen them on some lists, so I don't want to say until we hear the official word. I think that's going to be the most challenging group.
I would imagine. And of course, just to make sure that we're clear, that would be that next group.
Correct.
Healthcare workers first, then essential workers, which we think teachers will be a part of, and then high-risk patients, and then the general public. Thank you, thank you. Question, is the vaccine latex-free?
The vaccine is latex-free, and even the vials that it comes in are latex-free. So if you have a latex allergy, it's not a concern.
CDC question. The CDC says you can get the second dose of the vaccine with a 4-day, it says, wiggle room up to that 3 weeks. Is that what we're saying to our team members? Because the question as to how is Advocate Aurora allowing this?
Sure. So for Pfizer, we originally had set a 19 to 23 day time period for them, and I think we just learned they've extended it by a day. But so we're within that time frame. So after they get their initial vaccination, they'll get a ticket to sign up for their second vaccination, and our system is facile enough to know that they'll know what vaccine you got, what day you got it, and they'll only show you the schedule available for that time period.
Got it. So we will allow that wiggle room,
absolutely,
but not beyond it.
Right.
Yeah. Now you mentioned documentation or the sort. Will there be any sort of certificate or record that we can use to prove that we've had the vaccine? You mentioned getting into sporting events, getting into a restaurant. We're going to have to demonstrate sort of proof of vaccine. What will patients receive as a result of getting the vaccine?
So with each shipment, we are being sent a kit that has all the information we need to give the vaccine, the supplies, the equipment. And in there is the card. We are required by law, per se, the CDC, to give that vaccination card to every person that has received a vaccine.
Got it.
So once you get your vaccine, you'll get that card.
Got it. Thank you. Crohn's disease. Again, these are very unique questions, but we want to answer them for our viewing public. If I have Crohn's disease, should I get the vaccine?
Absolutely, especially if you're on any sort of immunosuppression for your Crohn's disease, you're a primary candidate for that vaccine.
And then, Jane, a question for you, just given our relationship with Walgreens, Advocate Aurora Health's relationship, will I be able to get my vaccine at Walgreens clinics? And of course, I think the answer is the general public, eventually sometime, not quite sure when though, right?
Correct. And right now, Walgreens and CVS are part of the national partnership with pharmacy to help provide vaccines in the extended care facilities and for their staff, so they're very much involved with that. I think eventually we may be receiving the injections, the vaccines at Walgreens, but right now we don't have that process set up.
Right. To be determined.
To be determined.
Yeah, exactly. So, Rob, maybe more of a science question. Let me read it, and then you can decide if it's science. Why are different companies manufacturing the vaccine with different recipes rather than all producing what works? Is it about marketing and each company making money? It seems national health should come first. Want to talk a little bit about that process?
Well, that's a really good question. There are many different ways to make a vaccine. And the more manufacturers you have working on different methods, the better the chances of having good vaccines. So far, it turns out the mRNA vaccines, which is a brand new technology for vaccines, the technology has been known for a while, it's the first time it's been used in a vaccine, turns out it worked really well. Some of the other vaccine manufacturers using different technologies, what we call a viral vector vaccine, some are protein-based and other strategies. The more different types of vaccine manufacturing you have, the better chance you have of having good vaccines. So I think that's a positive, not a negative.
Got it. So here's a question about heavy metals. I don't think they're talking about rock and roll music, right? So we hear so much about the dangers of heavy metals. When you say there's no mercury in the vaccine, does that mean that there are no metals or simply no mercury?
No heavy metals in the vaccine.
Okay, no heavy metals, thank you. Is the effectiveness of the vaccine compromised if you get it while you have COVID, but you're asymptomatic and unaware?
That's a really good question. So we don't think so. Obviously, if you're known to have COVID, we prefer if you wait until your COVID's done by 3 months, but I'm sure some people will get immunized who unknowingly had COVID. There does not seem to be any harm or risk to those people to getting the vaccine.
And Jane, when our team members slot and come forward, and we started yesterday, if anyone presents with a cold or a mild fever, do they still get the vaccine, or is that, I mean, maybe cold is different than fever?
Right. So we do have our Safe Care Promise. So anybody and all team members entering are required to have proper screening. So they wouldn't pass the screening in order to get the vaccine. So if you have a cold or a fever, you would not be eligible. We'd ask you to come back with when you're symptom free.
Got it, symptom free. And speaking of which, the question here is, do I need to be tested for COVID before I get the vaccine? And I think the answer is no. We want people
correct.
to get the vaccine.
If you know you've had COVID before, so we want you to wait 3 months, but you do not need to be specifically tested for COVID before you get the vaccine.
Thank you. Jane, when will healthcare workers not affiliated with a hospital get the vaccine?
We've actually included some of our physicians from APP groups who are in that high risk that are in our hospitals every day. So we do have a list of tiering and when we can do that. We do have to be really careful, though, that making sure that we are vaccinating our own team members or our own group first before we start reaching out. And we don't want to go beyond what the ACEP recommendations are.
So let me go a bit further, because I'm interpreting this question.
Okay.
Maybe apologize if I'm not getting this right for the person that wrote it in. What about healthcare workers not affiliated with a hospital? So physicians and nurses and healthcare workers that are Advocate Aurora Health or on the medical staff at one of they're kind of in.
Correct.
What about I work in a different kind of facility, or I don't specifically work in a hospital?
So local departments of health have enrolled as providers of the vaccine. And so I would recommend having those people talk to the local departments of health to find out what their plan is.
Okay, yeah. Direct them to the local departments of health. Makes sense. So can I donate blood after I've received the vaccine?
I don't think we've heard that question before.
Yeah.
And as far as I know, there's no reason why you couldn't donate blood after receiving the vaccine.
Thank you. I'm looking over these questions. Some of them are very similar. Let me see. This again, Jane, at the risk of repeating yourself, where can we keep up with the list of who's next and in high-risk groups? Do you go to the CDC? Where would you direct people to get this kind of information?
Oh, definitely. The CDC website has all the information, and they do post the advisory committee's recommendations when they're final as well.
Rob, again, another question about who's eligible, who isn't, and whether it's advisable. So I have an autoimmune disorder. Let's say it's HIV or mast cell activation syndrome. Is the vaccine safe for me?
Vaccine is safe. There's no contraindications for either of those disorders. If there's any questions, have a discussion with your physician ahead of time, but those are not listed contraindications to receiving the vaccine, especially, for example, somebody with HIV infection. We absolutely want you to get the vaccine.
Moderna versus Pfizer. Again, we've chatted about this a bit. Moderna versus Pfizer. What's the criteria to which one to get? And you would say whichever is available.
You get whichever one's available. Just make sure that you complete the series with the same one that you started with, but I would take either one.
Yep, and thank you for repeating again. You got to stay with that same series. Let's see. What is the reason behind waiting 3 months to get the vaccine if you have recovered from COVID?
That's actually a really good question, and the reason is mostly prioritization. The risk of reinfection with COVID seems to be very low within those first 3 months. After 3 months, it may increase somewhat. So if you are recovering from COVID or had it within the last 3 months, you're pretty low risk for reinfection, and as you maybe step back in line a little bit in favor of somebody who has not yet had COVID, they might benefit more from the vaccine now, but we still want you to get the vaccine after 3 months.
Got it. Thank you. Again, I appreciate this question because it allows us to repeat something that's so very important. So here it is. Why do I still have to wear a mask and social distance if I've got the vaccine, and for how long will I have to do that?
Right now, the best available information is that you do need to continue to wear a mask because of the potential you can actually still get the virus in your nose and spread it to others even though you've been immunized and may not get sick from the virus. Now that may change, and I'll tell you some very preliminary information from the Moderna vaccine shows that vaccine may also be preventive in acquiring the virus itself. And so as we get more data down the line, those recommendations may change, they may relax, but right now, if you go get your vaccine tomorrow or a week from now or 2 weeks from now, we want you to still wear a mask and to maintain social distance.
Yep, thank you, thank you. So the question is, how worried are you about the holidays? and COVID spread since the vaccine is still not widely distributed?
We're concerned, and we were concerned about Thanksgiving, and I think because we had a really strong message out, we really reduced the number of people who traveled or had large gatherings for Thanksgiving, but we are also concerned about Christmas as a family gathering time. You know, the way I look at this, we need one more really big push to get through the winter, because after the winter, the virus is mostly seasonal. We'll have probably lower incidence of the virus and also more people immunized. We all need this one big push to get through the winter. And it's possible, though actually we can get as many as 20 million people in this country immunized before the end of the year, which is miraculous, but we just got to get through the winter. So our advice is going to be the same for Christmas as it was for Thanksgiving. Do whatever you can to avoid large gatherings. Focus on 2021. And if we can get herd immunity in this population, Thanksgiving 2021, Christmas 2021 are going to look great. They're going to look just like years past.
You know, you both have been absolutely outstanding, and unfortunately, this is always the case with these events. We've not been able to get through every single question, but we're running close to being out of time. I'm going to give you both an opportunity to make some, whatever closing remarks you'd like to. Are there messages you'd really want to emphasize with the our viewing audience today? I know one question that gets frequently asked that I didn't get to is, what do you advise to folks that are afraid, right? How do folks deal with their fear? And we've talked enough, Rob, but you may weave that into your final comments, but I want to give you both an opportunity to express whatever you would. So, Rob, if you go first.
Knowing what I know, I am much more afraid of getting COVID than I am of getting the vaccine. And I want to put this in perspective, and maybe I should have said this in the beginning. This is an epidemic or pandemic that has taken over 300,000 American lives since its inception. We're losing about 3,000 people every single day from this disease. So I guess the question, when you look at the risks and the benefits of the vaccine, what would happen if there was no vaccine? What would the natural history of the pandemic be? How long would it last? And the answer is 2 years, 3 years, maybe longer. And I don't know too many people who could put up with that for another 2 years or 3 years. And then you talk about all the economic despair that comes out of that. We've already seen decimation of our economy that will only go on. We need a solution out of the pandemic. This vaccine is our ticket out of the pandemic, and it's our only ticket out of the pandemic right now. Are there going to be some risks associated with the vaccine? Possibly, probably, but there is no doubt that receiving the vaccine is safer than the alternative, which is getting COVID.
Thank you, thank you. Jane, final remarks?
Sure. We gave our first vaccine yesterday at St. Luke's, and I think all of us are really emotional about it because just as Dr. Citronberg said, it's that light at the end of the tunnel. And we're starting to see this feeling that we could do this, let's get this, and we're starting to see this groundswell. And I have to wait to get it, so I'm not a frontline caregiver, so I can't wait to get the vaccine, but I want those who are at the front line to give it first because I want to be able to see my family next Christmas. You know, it's as simple as that. So we're doing this not just for our patients, but we're doing it for our families, ourselves, and really the broader community. I really encourage you to take it if you have the opportunity, because, like I said, I keep quoting Dr. Citronberg, this is how we will end the pandemic.
Yeah, this is our ticket out. Yeah, well said. Folks, we are out of time, unfortunately, but we're going to continue this conversation in the days, weeks, and months ahead. As a reminder, you can find all the latest COVID-19 vaccine information at aah.org/vaccine, and that page will continue to be updated. Again, that's aah.org/vaccine. I also recommend you download our LiveWell app, where you can get all your health information in one convenient place and follow our social media channels for the latest health news and information. Like I mentioned, we intend to do more town halls like this. Your feedback is very important to us, and we want to hear from you, so please take a couple minutes to fill out the survey. Special thanks to Jane Dus and Dr. Rob Citronberg. Excellent advice, great education. I know that the viewers have benefited significantly from your participation. And we want to thank everybody for tuning in. We wish you all a very, very happy holiday season. And please continue to mask, social distance, and wash your hands. Until next time, folks, stay safe.